Hi, so today I'm going to show you how to mobilize your own kneecap. So your kneecap sits on top of your thigh bone. It's a joint called your patellofemoral joint. Your kneecap is called your patella, and your thigh bone is your femur. So it's not actually a joint like we typically think of. The kneecap is actually immersed in the quad tendon, which comes down, and it's inside the bottom of the tendon, and then it comes past and attaches to your shin bone. Sometimes the ligaments and the muscle and all the fascia in the area get tight around that kneecap and kind of stick it in place. So we do, as physical therapists and different health practitioners, we'll do mobilizations on that joint. So actually moving it around to make sure it stays mobile. When it gets stiff, it can limit and kind of make dysfunctional movement. So bending and straightening can cause a lot of noise, that cracking, grinding, and can cause pain as well. So here are some techniques that you can do yourself, either as a complement to physical therapy, or if you just can't get to physical therapy, to help with that mobility. So you want to have your leg out in front of you in a comfortable position. If this much extension or straightening is too much on your knee, you might want to put a towel underneath your knee to give yourself a little bit of bending. And what you want to do is kind of get comfortable with your anatomy here. So just kind of poke around and feel for the borders of your kneecap. People tend to think it's down here because that's where the bump on the knee is, but this is actually a fat pad that's supposed to be here. It has quite below the kneecap. So you want to look above that, try to find the borders. So mine, here's the sides, here's the top, and here's the bottom. The bottom's a little bit pointy. So I like to start just side to side with either index finger, pushing from one side to the other. This should not be painful. Sometimes the area can be a little bit tender where you're pressing. So try to be nice and flat with your fingers, not pointing like this. Now, side to side is good, but that tends to not be the biggest problem, especially when it comes to mobility in motion. It's usually inferior, superior, up and down. So I like to take my two thumbs at the top of the kneecap and just push down and see how far it can go. And then index fingers below, pulling up. This can be a little bit more uncomfortable because of where you're pushing. I can feel a lot of grinding under my kneecap. That's okay. Just keep it within your comfort level. Keep in mind that if you have difficulty extending your knee, getting straightening, then you probably have a little bit of difficulty lifting that kneecap upward. Those two movements go together. And in the same breath, if you have difficulty with flexion, with bending your knee, you might have some difficulty with that kneecap moving downward. So give that a try. You can just kind of move back and forth, holding in the areas where it's most limited. Do that once a day.